Welcome to Alimentary, the podcast series where you will learn about your amazing body, how it works, and of course why food is so important. We have our store cupboard staples at the end of each episode. We'll also learn more about lifestyle tips and therapies to help you to influence your health in a positive way. Welcome back to Alimentary. I'm your host Lynn, and in today's episode we talk all about reflexology and how it can support our health. But in particular, we talk about hormonal imbalances. So today I'm delighted to welcome back a guest who is a dedicated member of both the Sports Therapists Association and the Complementary Therapists Association, and someone whose passion for holistic and complementary therapy spans over 2 decades. Our guest began her journey over 20 years ago, training in aromatherapy, massage, reflexology and Indian head massage, earning multiple ITEC diplomas along the way. In 2004, after experiencing sports injuries firsthand, she qualified in Belfast with a diploma in sports therapy and rehabilitation. Since then, she has worked closely with amateur athletes and GAA clubs, even travelling on tour with the Ireland-Australian rules football team for both home and away games. But her expertise doesn't stop there. She has completed postgraduate training and now specialises in Oncology Reflexology, Oncology Massage, Lymphatic Drainage Massage and Aromatherapy for cancer patients. She is also highly experienced in reflexology for fertility and maternity, always using only pure organic essential oils in her practice. Her commitment to holistic health, sports recovery and patient-centred care is truly inspiring. So please join me in welcoming today's guest who brings both passion and expertise to every client she serves, Michelle Hutton. Michelle, thanks so much for coming on the podcast again. You're a returning guest, so we're delighted to have you. And so today we're really going to be talking about reflexology to give people a bit more knowledge about what reflexology is all about, but also in relation to hormone balancing, which can affect so many parts of our lives. So maybe could we start off with, could you tell us a little bit about why you became interested in adding reflexology to your list of therapies?
Yes, thank you so much, Lynn, for inviting me back on again. It's my absolute pleasure. So how I became interested in reflexology, well, that's a long time ago, over 30 years now. And I was training in sports therapy in Belfast, and in the college, they sent around a student who was looking for someone to become a model for them for their exams. So I said, yeah, I'd like to do that. So I was with her about for 4 sessions, and I was blown away with it. So I felt it. And as soon as I was qualified, that was the next course that I signed up for, and I've been using it ever since.
Brilliant. And so for listeners who are new to reflexology, can you just briefly explain what it is and how it works, especially in relation to the endocrine system and hormones?
Yes. Well, reflexology is a complementary therapy based on the principles that the specific reflex points on the hands, the face, the feet and the ears. So all of these areas we can work reflexology from. They correspond to different organs and systems in the body. So by applying gentle pressure to these reflex points, reflexologists aim to promote health. We can stimulate, we can balance, we can calm, and we can stimulate the body's own healing processes in order to keep the body in homeostasis.
I know it's fascinating how you can be working on someone's feet and you'll be able to tell from the sole of someone's foot how their gut is. You know, it really is mind-blowing, you know.
Yes.
So which reflex points are the most important for supporting hormonal balance?
Yes, so this is it's such an interesting area, the whole endocrine system itself. So those important points that correspond to the endocrine system, of course, the pituitary gland, the master gland. So he's the guy that sends out all the signals to all the other glands. sending out the chemicals in just the right amount at just the right time. And when I'm working, now this is just me as a reflexologist, so we're trained in a certain way, but then we kind of branch out a little, and there's different postgrads that we can do, like for menopause or like for fertility or cancer care. So there's a few different areas that you can branch out into. So when I'm working on the master gland on somebody's feet or face or ear or hands, I'm nearly talking to the pituitary to send out those hormones to the specific areas in just the right amount. So we're looking to bring balance from that pituitary to everywhere else in the body, because he's the master gland. He's the orchestra person. That's
the conductor, yeah.
Yeah. You got it. So we have the master gland. He controls all the other glands, regulates hormones like growth hormone, like FSH and LH, oxytocin, helps coordinate hormonal signals along with the hypothalamus. So the hypothalamus then controls sleep, temperature, stress. Thyroid gland regulates metabolism, temperature, and mood. Parathyroid glands regulates calcium and bone health. Then the adrenals, super important again, produces the cortisol and adrenaline, essential for managing our stresses. Pancreas regulates blood sugar through the insulin production. And then the ovaries, testes, production of estrogen, progesterone, testosterone. So working here to help regulate the cycles, fertility as well, and menopause symptoms.
So that really shows, Michelle, that how influential our hormones are in our overall health, really. I mean, we can often think of them just in terms of reproductive health, but really they affect everything, which is why menopause can be such a traumatic time in some cases, but it's definitely, a big change.
Correct.
Yeah.
Correct.
So we really need to throughout our life work on making sure that our hormones are as balanced as possible. So during a session, whether it is, as you said, reflexology can be practiced on the feet or the hands or the face. The facial reflexology is lovely. I get that from you fairly regularly. Can you just again, for anybody who hasn't had reflexology, just explain? You're just really massaging those. It's you understanding where those points are and massaging them and getting I suppose some information back from the body to say where there might be some imbalance.
Yes, indeed. So we hold, we can pulse, we can rotate on those certain points. So there's different movements that we do. Some movements would be light and gentle, some would be a little bit deeper. So all depending on what's needed, then we will adapt the session towards. Yeah. So when a client first arrives, after the initial meeting and greeting, we would sit down, have a little chat, we'd fill out a consultation form, and this will give me then a better idea of a treatment plan. So every session may be totally different, because if we're working at different stages of a cycle, whether it's to help to regulate a cycle or whether it's working on sleep deprivation, insomnia, mood swings. So every session will be adapted to how that client feels today. So depending on what's needed, and then I would focus on those specific reflex points that are associated with the endocrine system and possibly the nervous system and vagus nerve or the digestive system. And that all helps to support and bring balance back to all of those systems. And that's what we aim for, is to bring everything back to balance and either regulate the cycle or help with those menopausal symptoms.
Yeah, so really it can really support improving symptoms for whether it is, as you say, something like PCOS or, issues with the period, or then perimenopause and menopause as well. So Michelle, how might someone feel when they're having a treatment?
So during a treatment, the client may feel their body drop into a deeply relaxed state. You may notice that your breathing may slow down or a feeling of heaviness or warmth spread throughout your body. You may feel tingling or like a little buzzing sensation. And when I'm on specific endocrine reflexes like the pituitary or adrenal area, it can almost feel like electric, but a very soft electricity. Not a shock, but a little vibration. So on some reflexes, points related to hormonal imbalance, you may feel a little tender on those reflex points. A little sore or a little crunchy, but it doesn't hurt bad. It's like it can feel like a bruised area that's just being gently pressed, but not painful, but definitely a sensation.
Just a little tender, maybe.
Yes, a little. So that's what we're feeling for. We're trying to sense where there is a little imbalance, and as reflexologists, we wait for everything to join up, because that's what it's about, the balance. So we wait for the pulsing to become regular. We wait for the warmth, so the temperature, to become regular, and the color. So we look for an even color on both left and right foot, an even temperature, and an even pulsing sensation. So that's what we're feeling, and that's what the client is feeling also.
Oh, that's amazing. And I know you always show that you have diagrams in your treatment room and everything, so people can see, the different parts of the foot and what they relate to, what different organs they relate to and everything. So yeah,
that's
it's
right.
really
And
fascinating.
I'll often say to a client, if they are interested in knowing where I am working at any time, they can look up at the big diagram on the wall, and then we can chat about that later on. Oh, that point there felt very sore. But the majority of the time, the clients are somewhere else. They're in a very relaxed state, and afterwards then we'll have a talk about that. They'll say that, yeah, I will look up at the diagram because I'm so interested, but off they go, and we'll chat later.
Yeah, exactly. And often it's quite easy to fall asleep as well. So obviously there's no real sharp pains, because you wouldn't be able to sleep if it was uncomfortable or sore or anything, So
Yes.
yeah, you can drift off into a lovely, lovely deep sleep. And Michelle, I know particularly probably around hormonal issues, people might primarily think about women, but it can help men as well. And I think men are becoming better about maybe attending more complementary therapists. Would you see that yourself? Would you have maybe more men coming into your clinic?
Yes, a lot more, and a lot more of the professional men. And they're being sent by their doctors. Search out ways, especially the younger doctors now that are coming through, are very open about complementary therapies, and maybe try this out, or try let's try something else. But definitely I'm seeing a lot more men. Yes.
Well, that's really good.
And of course, always remember, in fertility as well, it's not always the women.
Exactly.
The percentages are 40% women, 40% men, and 20% unexplained. So,
yeah, exactly. So it's equally important to take care of of men's fertility, in addition to obviously the female in the partnership as well.
And a lot of women don't know, I suppose, or the tracking of ovulation as well. So we need to get a regular cycle to be able to track the ovulation. And there's many different ways now that we can help with tracking of ovulation as well, and that sometimes can be life-changing for women.
Brilliant. Is there much current research, with what are considered to be complementary therapies? Is there much research on the effectiveness of reflexology for hormonal issues, for any of those conditions?
There is, and the research is definitely growing, because I suppose it's driven by the general public, who are going out there finding these complementary therapies, and then they're bringing it back to the doctors or their healthcare providers. So then when all of that conversation widens up, then they want to start putting more money into research. But there's a lot of small studies I have found medical applications of reflexology. And I follow Barbara and Kevin Kunz, and they're a German couple, and they are doing a lot of research on reflexology. And they have some lovely literature that you can download off of the internet. Now, the HSE has booklets, and there's not so much medical-based research, but a lot of science-backed evidence. Also, as well, when I trained with Sally on the reflexology for menopause, she has a lot of references to like mentalhealth.org.uk. Of course, I did most of my training through the UK, Lynn. So that's why I suppose most of my medical or science-based evidence would be UK-based. There's not a whole lot in Ireland, but it is definitely growing.
Yeah.
And then more research on the effects of reflexology on sleep disorders in menopausal women. And that is through the social and behavioral sciences. And then the effects of reflexology on depression during menopause. And that was a randomized control clinical trial as well. Where was that done? That was done in Vancouver. So there's a lot of research being done. UK, yes, of course, America, Canada, Australia is a big place that they absolutely just have a lot of evidence on reflexology. Yeah.
And I think it's probably true to say that a lot more GPs are recommending things like reflexology and maybe acupuncture in particular. So the fact that they're willing to recommend complementary therapy shows that there is growing evidence to prove how effective they are.
Correct, Lynn. I work with quite a few clients who have fertility issues, and the fertility clinics are now recommending acupuncture and reflexology alongside their treatments as well.
Brilliant. And they could just boost a couple's chance of conceiving, and then of course maintaining a pregnancy. So you mentioned cortisol and adrenaline earlier on, and the old adrenal glands. Obviously stress is a huge issue, and so reflexology can help with that as well. Michelle, you have treatments for helping to maybe replete. I mean, the adrenal glands can become exhausted. So can reflexology maybe help in their recovery?
Yes, indeed. And of course, life now is so very high stress. So many of us are living in that high stress, turned on cortisol area for far too long in our days. And yes, reflexology can play a big part in regulating the stress hormone cortisol. There's some interesting evidence-based research through the serum cortisol levels and scores on the FSS. So that's the stress symptoms index baseline on fatigue and stress. Immediately after intervention and 1 month after foot reflexology, the group recorded lower levels of cortisol and fatigue than in the centralized group. So reflexology can reduce stress and anxiety, which were major triggers for cortisol release and reflex points of the adrenal glands and the nervous system calming, will help balance and help release more of the happy hormones, of endorphins, of the serotonins, of the oxytocins, which have the mood boosting and stress reducing effects.
So we'll say someone's in the middle of whether it is high stress or whether it's PCOS or perimenopause or menopause symptoms or fertility issues. How often should you have a treatment? So we're not talking maintenance, we're talking about when you're in the throes of it. How often would you recommend someone have treatment?
Now, it would be advisable, and it's a it's a big ask for people, but it would be fantastic once a week for the first initial month. Then after that, we break it down to bi-monthly. And then after that, continuing on monthly or 6 weekly sessions then after that. Mm-hmm. And if we can hit it at those times, amazing results.
Yeah. And so within, I'm sure that it can vary from case to case, but would there be an average amount of time that you might expect to see changes in the symptoms?
Sometimes even after the first session.
Really? Yeah.
Menopausal ladies who haven't slept in months reported back to me the next day, oh, I had the most wonderful night's sleep, deep sleep, and woke refreshed.
Yeah, because sleep is so important, isn't it? When you can't sleep, everything else goes to pot, really. Do you use, you obviously have a lot of other tools in your toolbox, Michelle. You're a very well qualified therapist in other therapies as well. So are there any other techniques or tools that you might use to enhance the reflexology treatment?
Yes, well, I like to use visualizations. I like to use guided meditations. I love to use hot towels and crystals and, of course, essential oils. So a essential oil is made specifically for that person for whatever their reason is for being there, whether it's sleep or anxiety or digestive issues. And I'll make a little inhaler stick for the client to bring home, and they will use that every day, 4 times a day, just a little waft of the essential oils to help elongate the session, the treatment, so it's a little bit more ongoing. And we use that blend as well on the reflexology.
Yeah, the essential oils are from my own experience of getting your treatments. I have to say the essential oil aspect, it is, you do feel like, oh yeah, Michelle has really put some thought into my treatment. You know, she's made this up for me, and oh my God, the scents and the aromas, you just relax straight away. They're fabulous. So I guess you're awakening all the senses as well, you know, with the treatment. You know, you've got you're awakening the smell, and then the visualizations, and just getting the body back into the present moment and open to healing, maybe.
Yes, correct. And you know, not everybody is open to a guided meditation, and I'll always ask, and maybe the first time isn't always the time for that, but as we work forward and once we get into a few sessions, yeah, that's all part of the treatment as well. And they love it. And then they start looking up their own meditations online as well and seeing what suits them. And that really helps. That really helps too.
Yeah. So obviously we mentioned that maybe when some couples are going through fertility treatment that they might be recommended to have reflexology and or acupuncture. So I presume it can help, reflexology can complement other approaches like, you know, diet, movement, and then of course the allopathic medical treatments. Are there, you know, particularly for hormonal health? So it can be used in conjunction with other treatments.
Oh, for sure. And it has to be because, well, I follow the 5 pillars for a healthy menopause. And this is what I will always speak to the ladies about. We must look to the diet, the nutrition. We must get our exercise, relaxation, good quality sleep, and purpose. So we delve into those as well.
Yeah, so you're actually maybe offering some tips about tools and techniques that people can use at home themselves for their self-care, as in addition to their weekly or bi-weekly or monthly treatments.
Correct, Lynn.
Yeah.
And then we'll always refer when needed to nutritionists, to acupuncturists, so they can get the best possible care for whatever it is that they're going through.
Yeah. And of course, if people can improve, you know, maybe make some even small lifestyle changes, it'll only enhance, and they get more value out of the reflexology then the next time they go.
Oh, yes.
Yeah.
Oh, yes. And somebody can be getting really good quality sleep. No, sleep isn't my problem, but it's the digestive stuff, or, you know, it's the joint aches and pains, or it's the brain fog. So everything, we try to look at everything individually and see where we can direct that client to.
Yeah, maybe get a win, which will lead to another win, you know, another improvement of a symptom.
That's it.
Yeah.
it.
Yeah.
Yes.
So we say someone is looking, they want to choose a reflexologist, particularly say for hormonal health. What should someone look for, or are there any questions they should ask, when they contact a reflexologist?
Yes. So we are registered on so we have a governing body. So in Ireland, there's two governing bodies, the NRRI, the National Register of Reflexologists Ireland, and the IRI, the Irish Reflexology Institute. Now, some reflexologists are associated with the AOR, so the Association of Reflexology, but that's more UK based as well. So yes, if they are a registered reflexologist, we have to do our CPDs every year. So we have to do a little bit of extra work every year. They keep a little check on that. So that then gives us our insurance then to work. And if you're looking specifically for hormonal, just ask that reflexologist, have they done any of the extra reflexology courses on hormonal health?
Oh, that's a good idea. Obviously, reflexology can treat a number of issues. Do you find that it is a lot of hormonal issues, or could it be just broad spectrum, anything at all that you find your clients are coming to you for?
A lot of hormonal issues, yeah.
Mm. Yeah.
A lot of infertility with couples. I think because women now are talking more about menopause as well, and these symptoms of joint pain and the brain fog, that we are asking the questions now. God, could I be in early menopause, peri-menopause? Could that be associated to that? Doctors are now more open to talking about all of these symptoms, but there's so many.
Yeah. We used to think it was like hot flashes, really, didn't we? And
Yeah.
the aches and pains were a surprise to me, and I think some of the symptoms, there's so many symptoms that, yeah, I don't think we expect that wide range of symptoms. So sometimes we can think, oh, I'm getting arthritis or, brain fog. You think you're maybe losing some cognition or something. So yeah, it can be
Yes.
scary. So yeah, it's
Yes.
a wide range of symptoms.
A wide range of symptoms. So yes, a lot of menopause issues, a lot of young women who are trying to regulate their cycle after being on contraception for so long, and maybe now is time to start their family, and they're finding, well, how long do I have to wait until my cycle returns? And yeah, wow, reflexology is so fantastic for that. Really, really good for that. Yeah.
I think even say the last 10 years, 20 years, life is just as we have so much more, probably particularly the last 10 years, there's so much more information coming at us all day, every day, like stress levels, obviously could probably compound any issues that anybody has too.
Oh, yes, yes. And reflexology like that will everything together, with the mindfulness, with a bit of guided meditation, with the essential oils. And I suppose I like to think like that I'm opening up so many different areas for my client when they come. It's not just a foot rub.
Yes, not at all. Yeah.
It's so much more than that.
Yeah.
And from that, they can take away how to lower their stress levels. Like even some, and I'm not just saying women as well, both women and men may not recognize that they're even living in that high stressed area until the body begins to tell them that they are. Something is happening within the body.
That is so true. I used to think I was, particularly, I don't worry a lot, but I can recognize now when I look back how highly stressed I was. And now, you're absolutely right. It's my gut. I'll start to get gut issues, and then I'll realize, oh gosh, I am stressed. I do need to, settle a little bit or whatever, the body always tells the story, doesn't it?
Yeah, body will always tell the story, Lynn, for sure, for
Yeah,
sure.
we just need to understand how to listen to it.
Yes.
Take a little bit of time to listen to it for sure.
Yes.
And are there any other situations where you would advise someone hold back from reflexology? Are there any contraindications to any other medical treatments?
Um, Epilepsy would be one, I suppose. That's
Mm.
always a little bit controversial as well. Um, if it's, if the medication, you'll know this from the consultation. Has their medication been changed recently? When was their last episode, and so forth. So a little bit of caution around epilepsy, open wounds, ulcers, any cardiovascular conditions, blood clots, history of blood clots, and so forth.
Mm. I
So
guess you'd be asking that at the beginning of with a new client anyway. You'd be checking all of that, wouldn't you?
yeah,
Yeah.
yeah, yes,
Great. Now, you're also trained in reflexology for cancer
yeah,
treatments, cancer patients. So again, if someone was having treatment for cancer, they should check that the reflexologist was trained
yes, yeah,
in cancer treatment in particular.
yes. Oh, definitely. And in if you were to go into the oncology unit in Cavan and ask what are the benefits of reflexology, they could ream them off from their people who they send for cancer care, either pre, during, or post treatment. The benefits of reflexology and all the other complementary therapies that we can offer, so beneficial.
So would it
So
help things like nausea, some of the side effects of the treatment?
correct,
Yeah.
yes.
Okay. And of course, helping to manage the stress through it, which of
The,
course is a really stressful
yeah,
time. Yeah.
yeah, yes.
So, is there anything that you wish that more people knew about the potential of reflexology for women's health? Is there any, say, one question that you get asked a lot that you might be surprised you're asked about it, or that you think people misunderstand about it?
There's just a foot rub.
Yeah, yeah. You said it earlier. It's
Yeah.
right. Yeah,
So
a nice, relaxing foot rub.
so
Yeah,
relaxing. There's a lot more to it than
yeah.
that. I suppose,
Everything's connected, isn't it? The whole body is connected. So yeah.
the best piece of advice for someone considering reflexology, yeah, look, is to find a registered reflexologist qualified in, well, if it is hormonal health, or if it is cancer care, or if it is fertility issues, um, to seek them out and go for it, give it a try. Definitely give it a try, and ask all the questions. Maybe to go with your little questionnaire all written down
Mm.
yourself.
And
Don't
if
be
it
afraid to ask the questions.
exactly, a good therapist would be happy to answer those questions
Oh yes,
and to
yeah,
address any concerns that you might have.
yes.
Yeah. Okay. That's brilliant, Michelle. Thank you very much. I think that obviously reflexology can have wide-ranging benefits for our health. And I think probably how busy you are and how hard it is to get an appointment with you is probably testament to that, along with all of your other treatments as well. But I will put your contact details on your website, where people can make a booking and everything online. I'll put all of that in the show notes. And thank you so much for your time and your expertise.
Thank you. It's my absolute pleasure, Lynn, as always. Thank you.
My thanks again to Michelle for her time and expertise. And it's great to know that we can get some holistic support as we try to navigate hormonal changes or indeed other health issues. So, moving on to the store cupboard staple for this episode, we are shining the spotlight on a vibrant, sometimes underrated little vegetable, and that's the beetroot. So the beetroot belongs to the same family of vegetables as chard and spinach, and you can eat both the root and the leaves. The leaves have a bitter taste and the root is sweeter. It originated in North Africa, was then cultivated by the Romans, and after that spread throughout Europe. In the 19th century, the value of beetroot increased because it was discovered that it could actually be converted into sugar. Now, beet greens have a higher nutritional value as they are higher in calcium, iron, and vitamins A and C. But the roots are still an excellent source of folic acid, vitamin B9, and a very good source of magnesium, phosphorus, iron, and vitamin B6. Now, beetroot have been used for medicinal purposes throughout the years, especially for the liver because they can stimulate detoxification. And they may also have anti-cancer properties thanks to the beta-cyanin, which gives them their lovely rich colour, of course, as part of an overall healthy diet and lifestyle. And of course, the fibre in the beetroot is brilliant for our gut health and motility, so they help to keep us regular. Now, you might think of beetroot as just like a salad topping or something that comes pickled in a jar. But really, this humble little root vegetable is a true powerhouse for your store cupboard. Whether you buy it fresh, cooked, or in a jar, its earthy sweetness adds depth and colour to so many dishes. It's actually really versatile, so you can, of course, slice it into your salads for a pop of colour, and you can blend it into smoothies for a natural energy boost. But you could also roast a little bit with some olive oil and herbs for a lovely little side dish. Now, if you can get the beet greens, they can be steamed, obviously washing them well and gently. And if you're going to boil your beetroot, then you really need to leave the root and the stem attached, and that helps to avoid, the colour leaching out and staining your hands or your saucepan. I personally love them roasted. I think that really sweetness really comes out when they're roasted. Now, actually, lemon juice can help to remove the stains if you do get stains on your hands or your saucepan. Now, you can also grate beetroot into a chocolate cake batter, and this adds a little bit of extra moisture and a sort of a subtle sweetness. And of course, you can blend it into a hummus for a stunning pink dip. You could also pair it with some goat's cheese, some walnuts, and a drizzle of balsamic vinegar for quite a simple yet impressive salad. Not only is beetroot delicious, but it's also great for your health. So studies suggest that it can help to lower blood pressure, support our liver health, and even boost athletic performance thanks to its natural nitrates. So next time you're stocking your store cupboard, don't overlook beetroot. It's affordable, nutritious, and endlessly adaptable. So it's truly a store cupboard staple worth celebrating. And hopefully there's enough information there to encourage you to put some more whole foods into your shopping trolley this week. Thank you for listening to today's episode. I just wanted to clarify that the podcast is for informational purposes only and does not substitute professional care from a doctor or trained health professional, nor constitute medical advice or services if you're in a position to need either. However, if you found it interesting, you can subscribe to make sure you don't miss future episodes, or sign up for my newsletter on lynsharkeynutrition.ie.